Happy JP Morgan Healthcare Week, Matthew Holt. We should be celebrating the biggest fundraising year ever for health tech, and instead, where are we? Not at JP Morgan, although you look pretty hungover anyway. It's the January 12th episode of Health in 2.0.
So Jessica, where are you celebrating the biggest digital health funding year ever? Which JP Morgan wild party are you recovering from? Oh no, maybe you're in a cubicle in Florida?
I'm in Florida. We had I think the same ethos as JP Morgan. There's a lot of people kind of drunk and wandering the street aimlessly. I don't know. It's Florida.
I mean, that's the after effects of all the COVID they've been swilling down. Yes, I'm hiding out in Tahoe. But I'm sure there is a virtual JP Morgan, there's a virtual taco party going on somewhere, something's good happening.
There is.
So tell us about the funding week.
Oh my God, the reports are out, and in typical style, we got Startup Health numbers first, 21.5 billion for the year, largest one on record. And then like usual, we have Rock Health following that up. They wait for Startup Health to publish and then subtract 6 or 7 million, and then or billion in this case, and then publish that. So they said 14.1.
All right, so they're about half. Either way, they're both double the year before, which was a little bit off the year before that. So these are mind-blowingly big numbers, and we've seen it, right? All the reporting we've done and all the stuff we've seen, that the 300s, the 500s, the 100s, they all actually add up in the end.
Yeah. Well, Rock Health said there was 40 mega deals, deals over 100 million, and that was 57% of that total funding amount that they counted. And it doesn't seem to me that anybody counted anything that happened with any of the publicly traded companies.
Yeah. I mean, we could add 18 billion or whatever the number is to that from Teletonga, right? All right. So it's huge. All that money sloshing around in the stock market. I mean, not quite they're adding Tesla's adding that amount to its market cap every day, or taking off, or Bitcoin or whatever. So we're in an insane time. And meanwhile, we did one of these shows in the middle of the coup insurrection mob riot last week, and didn't realize how serious it was. It's now come out that it's been pretty crazy, and we may have impeachment and God knows what in the run up. So it's going to be a wild, wild world. But meanwhile, we'll just do 2 minutes.
I don't know how this funding year is going to go, because usually Sarah Hallebeck has always said that you can tell how good the fundraising year is going to be for health tech by who's buying which VC funds are buying bottle service at which hotel. So now we don't know. I have no indication of what's going to happen. All right, set that time. Let's go.
Ready?
Yeah. All right, Aspen RX, it's 23 million and a B. Bessemer led this round. What do they do?
Yeah, I talked about them from Flight Capital a while ago. This is basically an online pharmacy network, with a platform to connect different community pharmacists. The goal here is that a lot of people are using pharmacists to do medication therapy management and basically clinical management, especially Medicare Advantage and Medicaid. A lot of tools in that world come to our work. We call Valera Health doing that. And this is a big sort of push to provide a online not for the pharmacy group to manage all that.
All right. Monument, alcohol treatment, they get 10 million, bringing their total up to 17.8 million.
Yeah, there's a number of these around, all right? So we've seen a lot of opiate addiction management services online. Monument, there's one called Tempest, run by, believe it or not, a former Health 2.0 volunteer, which has raised about 10, 12 billion as well. There's one called Rio, which does sort of medication management for alcohol as well. Whole bunch of this stuff. But this whole idea of managing addiction is going to become bigger and bigger as part of that, one of those subsets of mental health that we've been talking about. And by the way, I hear rumors that alcohol sales have gone up quite a bit in the last year. I wonder why.
I can't imagine. All right, what about Carrum Health? They get 40 million, pretty big B raise there. They're a centers of excellence play. I feel like we've been hearing a lot about centers of excellence recently.
Well, mostly because PBGH, Pacific Business Health, and Walmart have been doing it for a while, and Delta Airlines was doing it back in the 90s. It's big again, right? Can you reduce the costs of those expensive people by getting them to better, cheaper, faster surgery or whatever it happens to be? And Carrum is the big sort of private Silicon Valley play in that. They've been noodling around a while, but 40 million is a big number.
All right, Valera Health, they get 4.7 million. This is another mental health startup. How are they different, Matthew?
Well, they have a guy called Thomas Sang who was in the Obama administration. I've I said butted head with, so I've been on a couple of panels with him once or twice. Smart guy. They, I think, are playing more like an extension to your current mental health capacity role. So they're, I think, selling the health plans and to providers to try to expand what they currently have. And yes, this is another area where we need a lot more mental health because pandemic, et cetera, people alone, as we've been saying for many years, demand for mental health going up. Does seem to be that we have a massive overcapacity of new companies doing this, but as we've shown over.
That's not what I hear, though. I'm actually moderating. Shameless plug. I'm moderating a panel for health. It's a health go live on Thursday of this week, January 14th at 1 p.m. Eastern. And it's sponsored by Ginger mental health company. And their whole shtick is that the supply and demand equation for mental health services and mental health needs are completely out of whack. And so I've got a panelist from Ginger, panelist from Oscar Health, and a panelist from One Medical to hear the startup payer provider take on how we're going to rectify the supply and demand imbalance.
Well, there's no question we don't have enough mental health people, and we need to scale how we're doing mental health. And so like that little company Meru Health that I chat with now and again is doing, is trying to scale it using technology. Mindstrong's doing that. Everyone's trying to build in extra technology that they can have, and in the end, the supply of therapists is limited. Having said that, while the supply of therapists is limited, the supply of new mental health companies trying to corral them seems to be pretty much unlimited at the moment. So that's what I was commenting on. But yeah, I think
it's the same with telehealth, right? Everybody's a telehealth company now too.
Well, everyone's a telehealth company, so that's easy enough. Yeah. We'll find out more. One day, as Warren Buffett says, the tide will go out and we'll see who is swimming around naked. But for now,
oh dear.
Abundance never looks bobbing on the water.
All right. Well, Matthew, for those who want to follow along with you on Twitter, they should be checking out @BoltyBoy there. And to get more updates from me, I'm over at Jess Damasa. I miss JP Morgan. I feel like.
Hang on. It hasn't even started yet. How could you miss it? Well, I guess you would have been there yesterday. Today will be your first hangover morning.
It's a marathon, not a sprint. I was getting so good at this. Like I had water in my hotel room, snacks for late at night. It was a marathon, not a sprint.
So what you're saying is our main expertise of going to parties and being alive the next day has been taken away.
I should put together a whole tip sheet. Like there's like a point where you should eat. There's a point where you shouldn't. Which your substance of the best food? Never wear the same pair of high-heeled shoes 2 days in a row. You'll regret that.
I'll do that, yeah.
Or just give up on high heels altogether because it's usually raining. Everybody read into the fact that it didn't rain. And so they were like, it didn't rain at JP Morgan. That's it. We're all sunk. And instead, global pandemic, biggest fundraising year yet.
Shows that you.
Somebody didn't tell us.
It just shows that you can't predict. All right. Get us out of here.
Friends. I will get us out of here. To never miss an episode of Health in 2.0. Even though you might be missing JP Morgan, please be sure to go to thehealthcareblog.com and sign up there to get these delightful little episodes dropped directly into your inbox, along with a bunch of curated content from the blog. Also, Matthew Holtz is giving away things that are randomly set on that shelf behind him. He's got a Rubik's Cube, an empty plate, an empty flower pot, and some childhood artwork there. So yeah, if you want any of that, just feel free to ping the big guy.
Not giving it away.
Like I'm not partying with my Rubik's Cube. All right, and that's enough of this. We'll be back soon, you guys. Thanks so much for joining us. Bye.